Now, we move to how family is important. Now, I would say that one thing is maybe during my child's admission, I had to get a hotel room for me and my wife. I don't know why this happened. Some people argue it's a big issue. It has things to do with payments and payers and stuff like that. But let's talk about another story. It's a friend of mine. His father was having an operation in his back. It was, I think, cervical fixation. And after the operation was done, the patient's family, they saw that there was a problem with the father. And then the doctors kept telling them that this is just because of the operation. Now, of course, after so many beggings and so many pleads, no one listened to them, so they started doing their own research. Patients' families are very powerful. So they have seen that all the elements of a stroke is available. He has a facial drop, check. He had a part of his body paralyzed, check. And he had difficulty speaking, check. So after 45 minutes of this incident, a neurologist came and he confirmed that it was a stroke. That patient was in the hospital after the operation. Now he's been treating for 3 years. He's been doing physiotherapy for 3 years now. And he's getting better very slowly. So involve their families. It's only just about the little things. All right. We talked about that. And now this is the most important point, is communication. Now, Mr. Krajmir, the CEO of the American Accreditation Commission, where I work at, he always tells us to be elephants, not crocodiles. And the difference between elephants and crocodiles is that crocodiles have very big mouths and very small ears, while elephants have very big ears and very small mouths. So basically, we need to learn to listen. It seems like the only reason why caregivers have patient charters and consent forms and all these things is just for legal and financial issues. In a panel discussion early yesterday, they were talking about how patients and emergency service do not understand what triage is. Yeah, they do not actually understand what triage is. Of course they don't. So why don't we get rid of the paperwork? I don't say get rid of the paperwork, but maybe because no one reads anymore, we have to deal with that. Maybe we need to create more creative communication ways. Communication of information needs to be more creative. It is very possible, and you can actually go to any cosmetics clinic and you will find how creative they are in communicating. In that case, it's actually promotion, but I mean, people can get creative. Now, so also a while ago, the panelists mentioned that the use of language is very important. Like, we need to use a language that patients understand. And we all love like using very fancy words and abbreviations in healthcare. Patients may not actually understand this language. So we need to get down to the level of the patient's education and try to explain to them in their own language. I'm not saying English and Arabic and other languages, no, but I'm saying a language and a vocabulary that they understand. Now, we can also make waiting areas more interesting. Now, I've already talked about how time saving and all these things. So if you actually go to any hospital, I'm talking about changing time wasting time in waiting areas to actually invest in time in communication. If you go to any hospital, many hospitals have utilized every square inch of their facilities in promotion. You will find vertical screens, flat screens, horizontal screens, you find brochures, you find banners, you find everything. So they have utilized every space they have to do promotion. Maybe we can also use these resources to make better communication to patient information. Okay. Given the fact working in a healthcare, people may actually know what patient charter, for example, is. What are the patient rights and responsibilities? Now, do you actually think that people would actually go and read these things that are available in every possible place where the patient may have time to read them? Maybe we can create better ways to communicate in these rights. Now, I'm going to show you a video. It is not actually perfect, but it gets to the point I'm trying to make from a patient's perspective.
Do you know the Patient's Charter? It's a Ghana Health Service document that communicates the rights and responsibilities of patients and healthcare providers. Did you know that as a client, you have the right to know the diagnosis of your medical condition? You need to know the names of your caregivers, doctors, nurses, trainees, and other health workers at the facility. Your privacy during consultation, examination, and treatment is your right. The confidentiality of information on your health is assured unless required by law or is in the public interest. You are entitled to know your charges, mode of payment, and all expenditure prior to treatment. You are allowed to seek a second medical opinion if so desired.
As a patient or client, you also have certain responsibilities towards your health provider. As a patient or client, you are to provide full and accurate information to healthcare providers, comply with prescribed treatment, obtain all necessary information regarding management, treatment, and financial implications, respect the rights of other patients and healthcare personnel. These are your rights and responsibilities. Act on them.
All right, so that was it. Okay, it's always the little things, guys. Now I'm going to move on to the next part of the presentation. I only have 5 minutes, so we have screens here that show the counter. All right, I'm going to try to expedite this a little bit. Okay. Now, these are the things that I believe accreditors, as an accreditation bodies, need to be taken care of to make sure that the service being provided is patient-centered. Now, we can all see that accreditors, healthcare providers, and also regulators have done a very great job actually addressing safety issues. And I'm not saying that it's not important, it's actually the most important part of the whole patient care. But is it enough? Is it the only thing that is required? Now, first thing is be patient-centric. So that means that we need to focus more on ethical matters to have management involvement in patient centricity. We have to define a very good distinction between patient needs and doctor needs in the standards. And we have to spend more time and be there at different times. See, monitoring going into surveys in the hospitals in the morning shifts, which is like the golden shift for the accreditation, is very great. Maybe we should be going in the evening or maybe in the middle of the night when the double shift nurses are actually suffering and see how patients are being taken care of. Second point is qualify assessors highly. Now, we also have to qualify assessors in a way that they be able to talk more to patients, to spend more time observing interactions with patients, and to follow the patients and do retracing for patient experience. We also have to learn about the culture. So I would argue that we should intensify learning about the culture, even better, qualify national quality professionals who already know the culture. Yes, a third eye is very important. Benchmarking is very amazing. But how can an assessor from the Western culture understand a Middle Eastern patient without proper intensive orientation and training about their culture? Now, and I would say, do not become checklist monkeys. Now, you cannot just look at the patient record and conclude that everything is fine. I mean, looking at the piece of paper and checking all the elements does not mean that the patient is okay. Patient records is not the patient. We always have to remember that patient's opinion about their healthcare is not objective, it is something subjective. And that there are things that cannot be measured. Actually, at least the most important things cannot be measured as per Dr. Samer Al-Ham. We have already seen today that from Dr. Samer from the IMC, how almost everything can be quantifiable. Not only that, but he also showed that doing so actually makes a difference. Now, involve patients in standard development. I would say that we should distinguish between patient rights and medical tourism. I know that there is a fine line between both of them and they are all good, but patient rights should be more defined into centric care. And we have to make standards that promote patient centricity in addition to safety. So, I mean, I do not mean just making standards that look at patient signature in every document or record, but what I'm saying is that we should start with the patient first when we develop the standards. So, and another thing is to give incentive to healthcare facilities. And I have a question. Do anyone actually think that a patient cares if you are accredited by X or Y or Z? I mean, does it make a difference for patient, even if he's not accredited, the hospital is not even accredited? I don't think it makes a difference. So maybe we should make programs that certify patient experience rather than the services that are being provided in a hospital. Like make programs and excellence certifications and standards that address this point, address patient experience in healthcare. Right. All right. And the last point is to keep up with recent innovations in healthcare. Now we have all seen robotics, telemedicine, and I would say control of information is very important. We've all seen what's happened with COVID when COVID started in 2019, 2020. And I think we all agree that it was a huge mess when it comes to information. People knew, even people in healthcare had no idea what's going on. Is it airborne? Is it not airborne? All kind of questions and myths and wrong information going on the internet. You could, see that if you just Google it. All right. So I think that accreditors need to make sure that the content of information that are being communicated to patients are actually also verified. That's very important. And there is a very, very small service that AACI provides, which we are very proud of, is medical content certification as well. So anyway, my time is up and my presentation is finished. Thank you so much, everyone. And if you have any questions.
Thank you. Thank you so much. Any questions from the audience?
All right. Thank you, guys.
Thank you.